What we've covered it very, very quickly was the fact that terpenes are really the key to medical cannabis. And by identifying the terpene profile for your particular condition and then matching that to a product at a dispensary, you'll be able to identify the products that will help you address your condition. And again, starting low and going slow by try trading up and finding your therapeutic dosing level, you've then got yourself a medical treatment plan that can really help you with your condition. Now, what we're going to do now is answer any questions that you might have. We had some questions that were submitted prior to the webinar tonight. I do want to point out that you will receive, as a follow-up to this webinar, an email from us that'll give you a link to this video to watch. It'll give you a link to the YouTube channel, okay, that you can be able to watch that. You'll be able to also get a copy of the slides that you can go through, and then any references that are really here. So let's jump into the first question, and that is, can CBD/THC affect liver number? Well, right now there is the liver number means your liver function test, referred to as an LFT, and that's done by your primary care provider. Now, what's interesting is there has been no uh, studies that have shown that cancer affects the liver number negatively. There are some situations where cannabis has been able to help the liver, but there isn't anything that shows that it's causing the liver from a negative standpoint to be affected. Now, there's a lot of studies being going on. There hasn't been a definitive study one way or the other, so I'm not going to say yes or no, but I do want to let you know there are studies going on. And so far, the studies are showing, especially CBD, is helping quite a bit with a lot of different conditions in your body, including the fact that it helps with your liver. So I would say stay tuned. More studies are being done, but right now I wouldn't worry too much about that. What I'd worry more about is making sure you have the right terpene profile for your condition to being able to address it with medical cannabis. Next question is that someone is interested in dabbing. Dabbing is actually a lot of fun. Some people love dabbing. They prefer it over vaping. What you're basically doing is taking that dabbing, what they call rig, you're putting it up to a concentrate. And if you look at over here on the left side over here, you'll see that there's a number of concentrates that come into play. That's your rosins, your resins, your sugars, crumbles, waxes, diamonds, whatever. And what you're able to do is you're able to have that tip of that dabbing rig be hot enough that it actually starts to melt the actual concentrate itself. That produces the steam, or the steam that is brought through the dabbing rig. And it's like basically the same as vaping. It's a reverse vaping process. Now, a lot of people prefer to put the dab into the concentrate and do it that way. I prefer to take that dabbing rig. I have dabbing rigs that actually work very much like vape pens, where I can drop that concentrate into the vape pen and being able to use it that way. So there's a number of different ways of using it. Again, I prefer the vape pen approach, dropping it in. But again, dabbing is very, very viable. It's very cost effective. It also allows you to tune in the temperature setting, meaning you can get the right terpenes, and it's easy to use. So I recommend looking at dabbing. I know that in the past, old time cannabis users or stoners used torches and a few other things to do this. There's a lot more civilized ways of doing it today with dabbing rigs, and you may want to take a look at that. I dab, but again, as I mentioned, I dab by putting it in, but my concentrates in a vape pen, in the actual dabbing vape pen, and smoking it that way rather than doing the tip. Depends on your point of view and how you want to look at that. And then again, I'll point out there's a glossary here that you can find at MMTC to help you with a lot of the terms that you see on this particular sheet. Let's jump into the next question, which is, how can I calculate my use of multiple products so that they're in balance? I use together to use together as substitutes for each other. Well, you can use multiple products. What I typically do is I take a look at the onset and I typically look at the duration. Let me give you an example. In the morning, what I do is I grab a vape pen when I get out of bed and I take a hit off my vape pen almost immediately. Why do I do that? The onset time is immediate, meaning within a minute or two, I'll feel the effects. And it also works very well at getting rid of any pain that I might have, taking my pain level down to less than a 1. And I know it affects my inflammation because I'm getting more mobility. Now, that allows me to get started, but it will burn off within an hour or two out of my body. So I then take, what I'm then taking is uh, tincture drops. Tincture drops work in about 25 minutes for me, and they'll last anywhere between 4 to 6 hours. So that'll carry me into the early afternoon. And so again, I'm using different products, but I'm basing it based on what's easy for me to use and the onset and the duration time. In the afternoons, I usually make a choice. I would say about 50%, 60% of the time, I take another tincture product. But I have been known to take gummies if I have some things going on. Depends on what I've got going that day. I don't want to get high. I don't want. I need to be able to stay sharp, but I also want to be able to reduce my pain. So that's why I'm looking at different routes of administration. And do I substitute them for each other? Yeah, there are times I'll use gummies instead of tincture drops. Now, again, one's going to act in 25 minutes. The other one may take 2 hours to work. So I've just got to be careful about how I do that substitution and pay attention to being able to cover my time. What I'm pretty faithful about is in the evenings before I go to bed. I usually take I'm a chocoholic, so I'll take either a tab of chocolate or what I call my magic brownies, and that helps me fall asleep and stay asleep all night because those edibles work for 10 hours. And again, if I take them in before I go to bed, it'll take me through the night. Where if I'm using a tincture drop or even vaping, I'll be waking up in the middle of the night. So I hope that answers that question. And the answer is yes, you can use multiple products. And my key to using it is paying attention to the onset and the duration time. The other question is, do I need to know my cannabis plant's sex? Well, actually, you really don't. Most of the cannabis that you buy today comes from a female plant. You've probably heard the term sensimilla. Sensimilla is a way of growing cannabis or producing cannabis and being able to take the female plants and being able to trim them in such a way that they produce abundant amount of trichomes, which is what you're looking for in a cannabis plant, and using a minimum amount of male plants. And that's pretty much how almost all medical cannabis is produced today, is through the sensimilla process that's been going on for a long time. So no, you really don't need to know the sex of the plant. All you need to just know is that they're using plants that typically are female when they're producing most of the cannabis that's out there, and it's actually a process called sensimilla, or the process is called sensimilla. So you know that there's something that's been done for quite a long time, and that came actually out of Europe. Question is also, I had spinal surgery 2 years ago, and I'm in constant pain. I currently use flour, oil, vape, and edibles to help with the pain and nausea. How do I make it work all the time? Well, first of all, let's step back for a minute. We had a slide in here about pain management. Let's make sure that the flour, the tincture drop, the oil that you're using, and the edibles all have the right terpene profile. In other words, when you lose that flour and you burn that joint, what you're burning off is you're burning off about half of the cannabinoids, all the flavonoids, and all the terpenes. Excuse me, all the flavonoids and all the terpenes. So it doesn't surprise me that the flour doesn't work that much because you're taking the medical efficacy away, and you've got to use more flour to be able to address your particular condition. Now, in the case of using an oil or a vape, you should be able to get a pen, or you should use a pen that allows you to set the temperature of that particular vape pen to bring out the cannabis or more importantly, to bring out the terpenes that you're going to be looking for. You want to look at a temperature range of about 350 to 390. That would be the middle or the second tab or click on the vape pen, and you'll be able to you'll be able to see that that'll actually produce some smoke that comes out of there, but you'll actually feel the difference. It's really makes a big difference. If you don't have a setting on your vape pen, and the setting is going to probably be too high, and you're burning off a lot of those terpenes, hence why you're not getting the pain relief that's out there. Also, pay attention to edibles. A lot of edibles don't have terpenes in them. When you go to your dispensary, check the certificate of analysis, the COA, the certificate of analysis, to make sure that the terpenes are in the edible. Now, there's a lot of edibles on the market. I would say only about 25% of them come with a terpene profile. So I'd say pay attention to that. That's really important. That's really there. But I would say if it's not working, it's probably because you're not taking advantage of the terpene profiles. That's either through addressing it through looking at the COAs and the routes of administration. Next question is quick onset pain relievers for migraines, back, and neck pain. Vape pens. No ands, if, or buts about it. When I have my neck pain, when I have my back pain, I carry around a vape pen for that specific reason. If I step off a curb, if I happen to bang my knee, um, I need to be able to address that pain relief right away. And I'd say the vape pen is the best way of doing it. And get a vape pen, again, that you can set the temperature rating on it. You want to set that temperature rating between 350 and 390 so that you can take advantage of myrcene, beta-caryophyllene, and also the linalool, so that it'll be able to affect and address the pain and also the inflammation that you're looking for. So That's the best way, I think. That's my recommendation for the best way to go. Onset is the fastest. It works almost immediately. I'm sorry, the vaping works almost immediately. So that's probably the most effective onset time that you can take a look at. Next question is, how do I get approved for more dosage? Well, if you need more dosage, you can get a hold of your doctor. There's actually a form that he fills out and gives it to the get approval from the Florida Medical Marijuana (OMMU), the Office of Medical Marijuana Use. So it's a form that's filled out by your doctor. Call the nurse practitioner, call your doctor, fill that out, and he'll be able to fill that out. And usually that's approved within anywhere between 2 days, 2 weeks, depending on the condition and how busy the OMMU is. Next question is, what is the best flower selection for depression and anxiety? Well, I'm going to throw a little cold water on this. It's not a matter of what flower selection you want. It's a matter of the terpene profile. What's happening today in the cannabis world is they're making cannabis products that are called cultivars. These cultivars are a combination of the terpenes as well as the cannabinoids and the flavonoids to address a particular situation like depression, like anxiety. What you really want to pay attention to when you're looking at a flower selection is make sure that in the certificate of analysis, COA, that you have beta caryophyllene, you have myrcene, and that you have linalool. If you have those three there, that should help quite a bit with the best flower selection for anxiety and depression. And that should be able to address those. And again, also make sure you're using a dryer vaporizer, being able to set that temperature setting on your flower device so you can take full advantage of the terpene profile. Otherwise, you're just going to be burning it off if you're just smoking a joint and not taking advantage of the medical efficacy of the cannabis that you're using. If you have any questions, please feel free to ask. What I really want to point out is our goal with these webinars is to really help you get your life back. I know that a lot of folks have looked at medical cannabis as a treatment for their particular condition, and what we're trying to do is show you how to craft it, what the treatment plans look like, what terpenes work, and also the best way to be able to address it and be able to work with it when you go to your dispensaries as well as your medical cannabis doctor. There's a comment, I guess I might have made a statement that cancer doesn't affect the liver negatively. It does. Cancer has a tremendous effect on the liver. In fact, liver cancer is deadly, one of the most deadly types of cancers that are out there. If you are affected by cancer, and I'll talk about this more next week, we really want to take a look at a full spectrum product, the Rick Simpson oil, RSO. They call them FSO products today because the cutting agent's a little bit different. But there are definite ways to address the cancer issue and the liver issue using a medical marijuana doctor. Please talk to your doctor. And more importantly, if you get a chance, go go get a consultation done at your local medical marijuana dispensary. They're free, and they'll be able to help you identify the products that will work very much for you. And I also want to thank you very much for joining us. And we've covered a lot of subjects, but please feel free to ask us questions. And again, I hope that our goal, and I hope that we have been able to help you get your life back. Thank you very much for joining.